Awesome. All right, guys, let's check out some of these questions. Now we've got Lena. Red light therapy products you have FDA approved. Is there one specially for the eyes? So our red light devices are FDA class 2 certified. However, we don't have an eye specific device, but the panels work perfectly for eye and full body treatment. Ellen, please address how to use red light for cataracts. Red light therapy may help support eye health and slow the progression of cataracts by improving mitochondrial function and reducing oxidative stress in the lens. Using a medical grade LED device that emits red light at 630 to 670 nanometers or near infrared light at 810 to 850 nanometers, position the device 4 to 12 inches away from the eye and keep the eyes open during treatment. Start with 30 seconds to 2 minutes per eye daily and gradually work up to 5 minutes, 3 to 5 times per week. Morning sessions are ideal for syncing with circadian rhythms and enhancing cellular repair. While not a cure for cataracts, red light therapy may offer protective benefits and complement other eye health strategies. A 2008 study put photobiomodulation for the treatment of retinal diseases. A review found that red light therapy improved vision in patients with both cataracts and macular degeneration. After just 4 treatments over 2 weeks, 97% of those with cataracts saw their vision improve by about 2 lines on the eye chart with no side effects. This suggests red light therapy may help support vision even in eyes affected by cataracts. And here's the study here. You can see it all in detail there. C, you state opening screens that devices you offer are not what was used in the research studies. You mentioned what's the difference. Okay, so the statement you're referring to is included for compliance and regulatory reasons. It simply clarifies that the specific research studies we mentioned were not conducted using brand name devices. However, it's important to note that technology used in those studies is the same type of red and near infrared light therapy our devices deliver. So for example, it doesn't tell you what devices, like they tell you parameters, but they're not commercial products. So you can't buy the ones that are in the studies in the sense that they don't give that information. So that doesn't exist. So what you need to do is then take that information of what parameters were used. And because we have the highest tested irradiance, which is 205 milliwatts per centimeter squared at 3 inches, and then we've got the proven wavelengths, then you have the parameters that you need to make your decision. The other issue is a lot of these studies will tell you use even just one wavelength, but that's not going to be ideal for people, in that you may have lots of different conditions you're trying to prevent or several different conditions you're trying to go after. So hence why we're just using that super advanced technology. Some of these studies are a few years old, even 10 years old or more, and we're using the most advanced technology, which is awesome. Our devices are more advanced than those originally used in many of the studies, incorporating the latest LED technology, improved wavelengths, and optimized power output for enhanced results. Hence the results that you saw in the testimonials, they were all using our specific devices. So while we must state that we have that the exact branded devices using the research were not ours, the therapeutic principles and functionality are the same, if not superior in many cases. Chris, how long after surgery do we have to wait to use red light therapy stand or belt? What you mean the panel? After surgery, it's generally best to wait 2 to 4 weeks before using red light therapy devices like a stand or belt or near the surgical area. That being said, so we've got to use politically correct answers. For me personally, I would be using it immediately. That's what I would do. But the exact timing depends on the type of surgery and how you're healing. For minor procedures, about 2 weeks may be sufficient, while major or internal surgeries may often require a wait of 4 weeks or more. For eye surgeries such as cataract removal, red light therapy should only be resumed after a clearance from your ophthalmologist, typically not or before 3 to 4 weeks post-op. Although red light supports healing by stimulating cellular activity, using it too soon can overstimulate fresh wounds or interfere with recovery. Always consult with your healthcare provider before introducing red light therapy after surgery. Ellen, does red light help with osteoarthritis? Red light therapy can be highly beneficial for osteoarthritis, helping to reduce pain, inflammation, and joint stiffness. It works by improving cellular energy production and enhancing circulation, reducing oxidative stress in the affected area. Wavelengths like 660 and 850 are particularly effective as they penetrate the tissue to stimulate repair and reduce inflammation. Clinical studies have shown that regular use can improve range of motion, decrease morning stiffness, and reduce reliance on pain medication. For best results, it's recommended to use the light for 10 to 20 minutes per session, 3 to 5 times per week, with the device positioned 6 to 12 inches from the joint. Over time, consistent use may support cartilage health and provide lasting relief without the side effects of conventional medications. Even the Arthritis Foundation acknowledges photobiomodulation as a helpful complementary therapy. Bruce, can you look directly at the red light or will it damage your eyes? It's recommended to only look directly at the light source for 30 seconds or to 2 minutes, even 3 minutes at a time. So there's studies on that as well. While your body adapts to the therapy, studies have shown great improvements using red light therapy for eye conditions for treatments around the eyes, like potential cognitive or eye health benefits. Always use lower intensities, limit exposure time, and keep your eyes closed during the majority of the session unless otherwise guided by a practitioner. Lisa, although it's been 10 years since open heart surgery, I currently have multiple stents. Can red light therapy be used and heal arteries and scar tissue? Yes, red light therapy can still be beneficial for you even 10 years after open heart surgery with multiple stents. Red light therapy may help promote tissue repair, reduce inflammation, and relieve pain. For instance, a randomized controlled study found that low-level laser therapy applied after coronary artery bypass graft surgery decreased cardiac cellular damage and accelerated cardiac tissue repair, potentially lowering post-operative disability and best rest periods. Here's the study here. Let's have a look at that. So this is on PubMed, NIH. So you can see it there. There's the results. And then additionally, red light therapy has been shown to reduce scar tissue formation in cardiac tissue following myocardial infarction. A study demonstrated that low energy laser treatment, which laser and LED is the same frequencies and often the same intensities. There are studies that show specifically that the red line, and I'll show you this study. Everyone needs to see this. 62 out of 62. This study here is a blockbuster. In this case, they had lasers versus LED pads, and they showed that the LED pads were more effective. Here it says specifically that both conformal and LED pads and scanning lasers demonstrate favorable outcomes. LED pads deliver higher fluences than scan lasers in the same session times. So it's a high affluence partly because it's whole body, a whole organ. So this study here was from the European Society of Medicine. It's for acute and long COVID. After 2 sessions, all acute conditions go away for all 62 participants. And these were for whole organ deep tissue. And together, symptomatic recovery from 2 to 64 to 84-minute photobiomodulation sessions occurred within 3 days for 62 out of 62 patients. Full recovery occurred within 4 sessions for all PBM patients. All but 2 cases resolved within 1 week. So that's huge. Prophylactic benefits were recorded in 17 out of 17 family members. So if the patient, if they're exposed to an infected person, they would be protected out of 17 out of 17 cases. PBM of long COVID outcomes include total resolution of dyspnea, ability to maintain SpO2 above 97% without oxygen supplementation, relief from digestive distress, elimination of brain fog, improved memory recall, restored executive function, and symptomatically managing emotional deficits. These conditions are related to everyone, not just long COVID. If you've got any kind of brain fog, any kind of memory issues, any kind of executive function issues, you need to use red light. That's that simple. It was a 62 out of 62, and most of those, 60 of them happened within a single week. The other 2 got better in the following weeks. That's a game changer, and that was in favor of LED pads, which is what you have here. So this treatment significantly decreased the size of non-contracting scar tissue in the heart, reducing infarct size by more than 50%. And this is in this study here in Science Daily. Furthermore, red light therapy has been reported to promote tissue repair and reduce inflammation around surgical implants, such as stents, suggesting potential benefits in enhancing healing and reducing complications. Steve, do we need to get different devices for each of these wavelengths? No, our devices offer all the beneficial wavelengths mentioned in these studies. So each of these devices behind me, they all have the 9 wavelengths, and they all use at the same time, unless you use modes that take out them, or you can take out different wavelengths. But otherwise, all 9 wavelengths will be used at the same time by just simply plugging in the device and turning it on. Julie, I have a brown mole on my face. Is red light therapy safe? Yes, it's safe. Red light therapy is generally considered safe for most skin types and conditions, including skin with moles. Red light therapy works by stimulating cellular activity, increasing blood flow, and promoting collagen production in the skin. Does not use the type of UV radiation that can cause damage and damage skin cells or increase the risk of skin cancer. This article, which we can look at, discusses how using different kinds of light, like red light therapy is becoming popular, a popular way to treat various skin problems. These light treatments are non-drug related, easy to use, and can help with things like acne scars and even hair growth by working directly on skin cells. The article then presents several research studies that explore different light therapies for specific issues, such as reducing birthmarks, improving how patients understand laser treatments, such for sunspots, using LED lights for psoriasis, treating acne scars with lasers, and a combination of therapy for severe acne. The overall message is that light therapy is a promising and growing field for treating skin conditions. Marsha, let's come back to this 1 second. Okay, so would red light therapy help with Guillain-Barré syndrome? Red light therapy may offer supportive benefits for individuals recovering from Guillain-Barré syndrome. It can be complete paralysis of the body, particularly during the rehabilitation phase, while research specifically targeting GBS is limited. Studies on peripheral nerve injuries and inflammatory neuropathy suggest that red light therapy can help promote nerve regeneration, reduce inflammation, and relieve neuropathic pain symptoms commonly associated with GBS. Red light therapy also supports mitochondrial function, which may aid in restoring muscle strength and reducing fatigue after acute phase. Though it's not a cure for GBS, red light therapy could also be a valuable and complementary therapy to enhance recovery. So this was a study that we clicked on before for photobiomodulation and skin diseases. And there's the article there, or the research piece, and you can check that out. Also look at the, what we're finding as well is that paralysis is actually connected to animal venoms. This is a study done on the Bothrops asper snake, and light-emitting diode therapy reduces the edema, the myotoxicity, here it is, and the inflammatory infiltrate, and etc. other categories. So I believe a big part of the reason why people are paralyzed with things like Guillain-Barré is because of this toxic venom issue that's happening. And so nicotine was also very effective. I would be using nicotine together. I'd be using chlorine dioxide, and I'd be using red light therapy. Now, I do believe you could expect a complete recovery. Not making a claim, but I believe it's possible. And I see that kind of thing happen a lot. Christina, can red light therapy be beneficial to enhance healing right after PRP treatment on the shoulder? Red light therapy can be beneficial after a PRP, platelet-rich plasma treatment, especially for enhancing healing in the shoulder. While it's important to allow the PRP injection to take time to take effect, red light therapy can complement the regenerative process by boosting tissue repair, reducing inflammation, and improving circulation to the area. Red light therapy helps by increasing cellular energy, ATP, which supports the platelets and surrounding tissues in repairing more efficiently. It also helps reduce pain and inflammation without interfering with PRP's effects, unlike anti-inflammatory drugs. Additionally, RLT supports blood flow to deliver oxygen and nutrients to the injured site while promoting collagen synthesis, tissue regeneration, which is particularly helpful in joint and tendon recovery. It's generally recommended to wait 24 to 48 hours after PRP to start red light therapy to allow initial inflammatory response to occur, after which consistent sessions of 10 to 20 minutes a few times a week can aid the healing process. Joy, will this work for frozen shoulder? Red light therapy may be a helpful treatment for frozen shoulder, offering relief from pain, inflammation, and stiffness by stimulating cellular energy production and improving circulation. Red light therapy promotes tissue repair and reduces inflammation in the shoulder joint capsule, key factors in frozen shoulder recovery. It can also help restore range of motion and alleviate discomfort when used consistently. While direct studies on frozen shoulder, a limited research on related joint conditions shows that red and near-infrared light, typically 660 and 850 nanometer wavelengths, can significantly improve mobility and reduce pain. For best results, sessions of 10 to 20 minutes, 3 to 5 times per week, with the device positioned 6 to 12 inches from the shoulder. I'd say even 3 inches is better. Recommended red light therapy can be especially effective when combined with physical therapy or gentle stretching exercises to support long-term healing. Red light therapy. Can red light therapy help with hypothyroidism? Man, I'm just going to answer this with these studies. Let's pull that up. Let's see what I got here. Look, this is a blockbuster. This is as good as it gets, I'm telling you. Watch this. So this is a 9-month study, 9-month follow-up. They only used 10 sessions. They only had it for 5 weeks. So now for hypothyroidism here, and this was so they were all taking levothyroxine, and this was 15 patients. The results showed that after the red light therapy, patients required a reduced dosage of LT4, everyone. So all patients had a reduced dosage, with 47% of them needing no LT4 at all during a 9-month follow-up. Okay, so that is huge. Why? Because they only did 10 sessions, only for 5 weeks, and then they were tested 9 months later, and 47% of them didn't need LT4 anymore. And so this is, they had additionally levels of thyroid peroxidase antibodies decreased, suggesting a reduction in autoimmune activity, indicating improved thyroid tissue health. Look at this one here. This was a Hashimoto's case. 74 women. They did only twice a week for 3 weeks only, and then they took them off it. Like the other one, they only were on it for 5 weeks, 10 times total. They took them off it, and then now 9 months later, they test them after being off it for like 7 months, and they already had like half the group go into basically remission of hypothyroidism. And in this case, after 3 and 6 months, the group that received PBM therapy showed better results. They had lower levels of thyroid stimulating hormone, thyroid antibodies, and needed less LT4. They also saw improvements in body measurements like body mass index, waist to hip ratio, and hip to waist circumference. Okay, so they lost weight, and then even if you've had radiation, you can see these studies that are done on radiation. So PBM helped restore cell growth and activity in thyroid cells even after they were harmed with radiation. So this is a treatment for hypothyroidism, even caused by radiation, and it's a useful treatment. And this is the clinical study here. Clinical study was here for this one that I showed before, and clinical study for this one is here, etc. Okay, so there you go. There's a good answer for that one. And on for macular degeneration. Macular degeneration, am I supposed to look at the lights? If so, without goggles, and what wavelength? So 670 was found to be effective, but all the red and near infrared, all of them are helpful. They're all in the optical window. They're all received by the mitochondria, and that's why we've got all the great studies on that. Safety is crucial, and so you're improving mitochondrial function, reducing oxidative stress, and which are factors related to age-related vision decline. So you could look directly in it without goggles for 3 minutes each morning. Studies are showing that doing it once would even result in a 17% eyesight improvement. That was particularly for the various types of myopia. But macular degeneration is all connected to it. The protocol would look directly at light once daily for 2 minutes, 3 minutes. Make your choice there. Do it in the morning, not the evening, closest to waking up if you can. Otherwise, just do it in the morning. And so Janet, my dog has a large growth on his foot. I wanted to try red light therapy, but I'm concerned it will make the tumor growth grow. So no, it won't do that. Red light therapy can be a helpful and supportive treatment for your dog's growth, especially if it's benign tumor or cyst. Red light therapy works by promoting, and if it's not, it's cancerous, then the cancer cells are going to be caused to die through the red light therapy through apoptosis. Red light therapy works by promoting healing, reducing inflammation, stimulating circulation, which can aid in recovery and overall health of the tissue surrounding the growth. For non-malignant growth, red light therapy can help reduce discomfort and support the body's natural healing processes, potentially improving the appearance and health of the area. Can also help manage any associated inflammation, promoting a more comfortable, faster recovery. Of course, it's always best to consult with your veterinarian to confirm the nature of the growth and ensure that red light therapy is a suitable option for your dog's condition. However, if the growth is benign, red light therapy could be a great way to support healing and help your dog feel more comfortable by using specific wavelengths of red or near infrared light, typically between 630 and 850. It stimulates mitochondrial cells to produce more ATP, as you can see, and this is a double randomized control study here, which is a veterinary world. It's on PubMed. For chronic wounds in dogs, photobiomodulation therapy, a randomized controlled clinical trial, results, conclusion, a steady decrease in wound size. The percentage of wound area reduction was found significant difference between a wound area reduction was found to be significantly different between the photobiomodulation group and the non-photobiomodulation group, which is amazing. And they've just put that as photobiomodulation therapy, hence the PBMT, same thing. Karen, can this help with HPV? Red light therapy may offer potential benefits for managing symptoms related to HPV, particularly in terms of supporting healing and reducing discomfort. While red light therapy does not cure the virus itself, it can enhance the immune response by boosting cellular energy production, which may help the body fight off the infection more effectively. Red light therapy also has anti-inflammatory effects. It can reduce irritation and discomfort from HPV-related lesions, such as genital warts. Additionally, it promotes tissue repair by improving circulation, stimulating collagen production, which can also accelerate the healing of lesions and reducing scarring, considering pairing red light therapy with a photosensitizer for a stronger effect. Leah, I have a tracheal stenosis, so severe inflammation in the trachea, and then excess mucus, which makes it hard to breathe. Sounds like red light therapy can help with that since it helps treat asthma. And red light therapy may offer supported benefits for tracheal stenosis by reducing inflammation, easing tissue irritation, and potentially improving breathing. While it's not a cure for the structural narrowing of the trachea, studies have shown that red and near-infrared light, especially at wavelengths like 660 and 810 and 850, and between those numbers as well, can reduce airway inflammation, mucus overproduction, like in asthma or COPD models. By stimulating mitochondria in the cell lining airways, red light therapy produces more energy, ATP, which promotes healing and reduces oxidative stress. These effects may help relieve some symptoms of tracheal stenosis, such as swelling and excess mucus, making it easier to breathe. However, it should be used cautiously with the right device and ideally under medical supervision, especially for conditions involving the airway. This study, photobiomodulation effects or photomodulative effects, looks at how low-level laser therapy can heal the tracheal wounds, especially in animal models. And animal models for the purpose of using them on humans. Researchers used the 635 laser on rats, improved wound healing on the side of tracheal incision. The rats were divided in two groups. One that gets it, one that doesn't. After 2 weeks, the results showed that the group that got it reduced the inflammation, scar tissue, and thickening of the tracheal walls. That also promoted better cartilage healing. This suggests that using light therapy can also be useful in the treatment to prevent complications like tracheal narrowing. And so this is the study here. All right, guys, in the last couple of minutes here, just got a few more questions to go. Thank you for your patience. Thank you for showing up. Carol, can red light help with gallbladder inflammation and prevent surgery from removing the gallbladder? Red light therapy shows potential in reducing inflammation and promoting tissue healing, which could be beneficial in conditions like gallbladder inflammation. Red light therapy works by penetrating the tissues for specific wavelengths of light, stimulating cellular processes such as energy production, improving blood flow, and reducing oxidative stress and inflammation. However, while red light therapy can help manage inflammation and potentially support healing of tissues, is not enough scientific evidence prevent the need for gallbladder. So it's not saying that we don't have data to say like, okay, this is going to prevent gallbladder removal. I believe it's definitely possible. Especially, I would be using chlorine dioxide solution, guys. Like, you guys need to know about that. We've been educating on that. Look at the book Achieved Health. You can get it on Voedia, VOEDIA.com, and that's going to be a game changer. I would be using chlorine dioxide, and I'd be using red light therapy. Okay, and so it is providing symptomatic relief, and it's reducing pain or discomfort. And Christina's asking, is red light therapy safe for someone who's had carotid artery surgery? And red light therapy is a safe carotid artery surgery to do after it, but a healthcare provider's guidance is essential to make sure it doesn't interfere with recovery. Always follow the advice of medical professionals who are familiar. Deborah, is LED the same as red light therapy? Yes, they're closely related, not exactly the same. So LED is using specific wavelengths, and like just red light therapy in general could be using a halogen or incandescent bulb, or it could be using an LED. Both of them are red light therapy. The irradiance is much higher in LEDs, hence why they're the ones that are showing up in the studies. It's up to 10 times or more higher in the amount of light delivered into the mitochondria, and because 90% of the power is going into light, whereas in the bulbs, like incandescent bulbs and halogen bulbs, about 90% of the power is going into heat, hence why only a little bit goes into the light, and therefore the mitochondria is not as benefited. That's why the LEDs are so much brighter. And they're also much more energy efficient. So an LED panel will cost you a lot less over time than even a $10 chicken lamp. I'm not even exaggerating. About 3 years in, it'll cost you more because of the energy consumption. They're power hogs, and they're a little unsafe as well, like with house fires and things like that. But they should be used if that's all you have the option to get. You should use that. Even, just keep those factors in mind though. Julie, any help with thrombocytopenia for chronic normal morphology, recent decline, near 50K working with alternative doctor for 2 months to detox? I have a 500 watt panel. If so, what do I do to target my midsection, liver, bones? For someone with thrombocytopenia, applying red light therapy to specific areas may enhance the platelet production and overall blood health. The liver is a key organ in platelet production, so placing the red light panel directly on the upper right side of the abdomen where the liver is located is beneficial. Additionally, targeting the bone marrow is important, so placing red light therapy panel over the sternum, spine, and pelvis can stimulate bone marrow activity. These areas where blood cells, including platelets, are produced, it's essential to follow the recommended treatment duration intensity using the 500 watt panel for about 10 to 20 minutes per session, and doing so 3 to 5 times per week. Julie, can red light therapy help PMS? What about severe varicose veins? Yeah, I've seen it work amazing for both of those. Red light therapy can help alleviate symptoms of premenstrual syndrome. Though it's not a cure, red light therapy can be beneficial in managing pain and discomfort associated with PMS, such as cramps, headaches, muscle pain, thanks to the anti-inflammatory and pain-relieving properties. Additionally, red light therapy may help improve mood by supporting nervous system, potentially reducing anxiety, irritability, and mood swings commonly experienced by PMS during PMS. And it also promotes better circulation, which can help reduce bloating and improve energy levels during the luteal phase of the menstrual cycle. Varicose veins, red light therapy may offer some benefits for managing severe varicose veins, but it's important to understand that you should be used as part of a comprehensive treatment plan. Red light therapy can improve circulation, which can help reduce the discomfort, swelling, and heaviness often associated with varicose veins. Additionally, its anti-inflammatory effects can alleviate pain and swelling that come with the condition, while also promoting tissue repair by encouraging collagen production and cellular regeneration. Red light therapy can provide pain relief by soothing the affected area and relaxing muscles and blood vessels. Trent, is the red light therapy working through your jacket, or is it too thick for the waves to make it through? It may be too thick. I wouldn't do it. I'm just doing it for like demonstration. For best results, it's recommended to wear light clothing or no clothing at all to the target area to penetrate more effectively. If you prefer, you can keep the jacket on. You should just sit closer. But I would take it off. If most amount of clothing, I'd have a training bra for a woman and jocks or shorts. And then at least you're getting most of the body. But otherwise, I would be Adam and Eve in the Garden of Eden, completely naked, and get it over all these other areas that don't often get exposure to light. Leah, product question, size and durability aside, the red light belts mentioned in the recent docuseries, the same thing as these red light stands, or just a small scale. So they have higher irradiances in the devices, so it's up about twice as much power. But the belts at that 95 or 92, 99, that milliwatts delivered per centimeter squared and the hats is still super high, and so it's still very effective. And so they do work extraordinarily well for all different types of things. Leah, is there a sweet spot for how much is the ideal time for sessions for general wellness? We're saying 30 minutes, 20 minutes, even though it's 10 minutes. And ideally you could be 6 to 12 inches, ideally 3 inches is what I'm saying. Okay, you got burned over your body after taking antibiotics. I'm so sorry, SLB. Yes, red light therapy. I've been detoxing the last 2 months, got much better, still have burns. Will red light therapy help? Yes, it helps so much for burn-like skin damage caused by a reaction to antibiotics, especially since you're already on a detox. Red light therapy is well documented for its anti-inflammatory, skin regenerating, pain relieving effects. It works by stimulating your cells, the mitochondria, it speeds up healing. This study is showing this wound healing in 3rd-degree burns here, and so you can check that out here and read more about it. But it was extremely effective in this 3rd-degree burning, which was in rats. So that's awesome. Leah, has anyone ever noticed an increased feeling of heat in the body using red light devices, either or during or afterwards? It's quite common for people to feel warmth, but not like burning, but just warmth. And then the gentle warmth is a part of the healing response. And so if you're feeling that, it's actually a very normal and a very beneficial sign. So I'd be continuing to do that. If getting very uncomfortable, you're having some issues or challenges, then that's where you can kind of ease up and do it more gently, do smaller sessions, do further away and do other things to help support your detoxification. Leslie, if I do 20 minutes of my shoulder, another 20 minutes of my face, do I need to do only, or do I need to only do 20 minutes sessions per day? No, you could do 20 minutes on different parts of the day, and that's totally fine. So you go 20 minutes here, 20 minutes here, 20 minutes. Like if you're moving it around, then you could do a lot. And I just had a case a couple of days ago where the guy used the belt for like almost the whole day. It was something like 5 hours. I don't tell people to do that, but he had tremendous benefit. He couldn't move his shoulder at all. And then he went to full mobility the next day. He's getting married this weekend, so lucky him. Good for him. Guys, this has been awesome. I appreciate you. Thanks for showing up. Remember, we've got the offer closing down. So go back to the page there, look at the offer, go and view the offer there, and make sure to grab it before we close that down on midnight this coming Sunday on the 28th. The 27th of April. Use the code RL10 at checkout. Choose the package that best suits your needs. Put the code RL10 when you're checking out, and grab your program here. You can read more about it on the page. You can watch the replay on the page as well. You can read more about the wavelengths and all the great things that you've been learning in this. Look forward to seeing you inside the program. Thank you so much for your support. Thanks for showing up. I appreciate you guys so much. And thanks for staying until the end, everyone. We'll make sure to give you all the gifts that we talked about. And again, thank you so much for your time, your love, and everything. We'll be in touch, guys. And again, God bless everyone, each and every one of you.